Why do you say the optimal level of alcohol is 0? Aren't there studies saying red wine is good for you?
When it comes to alcohol, the research that shows that red wine is good for you, I'm a little suspicious of. My guess is they are comparing people who drink lots of red wine with people who don't drink, who are former alcoholics, who were former alcoholics. And so they have a lot of health issues. So they're not necessarily comparing them to healthy individuals who are, non-drinkers. And so I'm suspecting that. I'm not positive of it, but I think we have to be very careful of that research, because we know beyond any shadow of a doubt that any amount of alcohol increases cancer risk. And it's really simple. Alcohol is helping carcinogens get into cells. It eases the entrance, if you will, of carcinogens into cells. It also speeds the oxidative stress. It creates free radical reactions. And so we know that there is no amount of alcohol intake that is helpful in terms of cancer, and any amount is harmful. We know that alcohol can also increase risk of liver disease, and there are other adverse health effects associated with excess alcohol consumption. So in my view, the optimal intake of alcohol is 0. If you drink, you definitely want to keep it moderate, and that means on occasion and in moderation. I don't know that there's anything wrong with having a small glass of wine once in a while, but I'm not sure it's a good idea to make it something you do every evening, and something you do. I can remember so many, when I was a young person, so many of the adults I knew, it was a drink before dinner, like a rye and ginger or something. It was a glass of wine with supper, and it was an after dinner little liqueur or something after supper, and that was standard. And this is just not a good plan. So I think for, just for most people, the less, the better.
Brian Clement says all sugar, including fruit, feeds yeast, mold, and fungus, and that we should eat only around a piece a day. Do you agree with this? What have you observed in people's blood sugar levels when they ate or did not eat fruit?
Well, I have a different experience, and I know Brian's basing his recommendations on his experience at Hippocrates and working with cancer patients, and I appreciate that. But based on science, we come up with something quite different. And even my experience I work more with diabetes than with cancer. I just don't see that. But if you go on PubMed, this is where the research is available to everyone, and you do a search, fruit and health, or fruit and heart disease, or fruit and cancer, or fruit and diabetes, whatever you search, you can't find negative studies. They are non-existent. As a matter of fact, 2018, there was a research team that published a meta-analysis of 356 studies on the relationship between fruit and disease. And basically what they said is that fruit consistently reduces the risk of cardiovascular disease, hypertension, diabetes, various types of cancer, depression, osteoporosis, skin disorders, GI disorders, just a laundry list of diseases. It was quite amazing. And then their conclusion is that they're recognizing that fruit is contributing, the lack of fruit, that low fruit intake is a very significant contributor to global morbidity and mortality, and that we need to be putting more emphasis on it based on 356 research studies. In terms of looking at what it does to blood glucose, there was a study from Denmark not so long ago that compared very low fruit intake with higher fruit intake, and they saw no differences in terms of glycemic response in the individuals. Fruit didn't have an adverse effect, and they said that fruit absolutely should not be restricted. There were 2 studies that I know of that looked at giving people 20 servings of fruit a day, and even then they saw improvements in cholesterol and triglycerides and all of these things that were fairly surprising to the researchers. There are a couple of folks that run this, Cirrus and Robbie, that run the Mastering Diabetes site, and they promote a very fruit-heavy diet for people with diabetes, and their results have just been stellar. So a lot of us who have been hesitant to include too much fruit in the diet are recognizing that it's probably not such a big issue. And I have to say, from a personal perspective, I've always been a heavy fruit eater. Even as a child, my mom would buy a basket of peaches and they would be gone in a day and a half. I would eat 3 or 4 at the time. I would eat, blueberries, just bowls full. And so I'm a little bit partial to fruit. I love fruit, but I think it's a wonderful source of potassium. I can remember when we were analyzing our menus for our Becoming Vegan books, we actually had a hard time getting potassium up to where it needed to be without including a significant amount of fruit. I think for most people, eating 2 or 3 or 4 or even more servings of fruit a day is not a problem.